A 14-year-old boy is brought to the emergency department after accidental ingestion of a chicken bone that lodged in his esophagus. Upper endoscopy is performed and the bone is successfully removed. However, the patient is incidentally found to have mild hypercalcemia on laboratory testing. On follow-up with his primary care provider 2 weeks later, he has no symptoms and clinical examination is unremarkable. Further questioning reveals that several of his family members also have mild hypercalcemia. Subsequent laboratory studies show a borderline high parathyroid hormone concentration, very low urinary calcium level, and normal 25-hydroxyvitamin D level. The question is, a mutation in which of the following receptors is most likely responsible for this patient's laboratory abnormalities? If you are one of the smartest people on Earth, type the correct choice in the comment box below. A. Intracellular receptor with a DNA-binding domain B. Membrane-bound receptor coupled with a G protein C, transmembrane ligand-gated ion channel D, transmembrane receptor associated with an E transmembrane receptor causing activation of Janus kinase STAT pathway. I am guessing you did not get the answer right. The correct choice is B, which is membrane-bound receptor coupled with a G protein. Calcium-sensing receptors, or KSRs, are transmembrane GG protein-coupled metabotropic receptors that regulate the secretion of parathyroid hormone in response to changes in circulating calcium. Binding of calcium to calcium-sensing receptors leads to the inhibition of PTH release, whereas low calcium levels allow increased PTH release. Familial hypocalciuric hypercalcemia is a benign autosomal dominant disorder caused by defective calcium-sensing receptors in the parathyroid gland and kidneys. In familial hypocalciuric hypercalcemia, higher serum calcium levels are required to suppress the secretion of parathyroid hormone. This raises the set point of calcium-induced regulation of PTH secretion. Patients with familial hypocalciuric hypercalcemia have mild asymptomatic hypercalcemia, reduced urinary excretion of calcium, and high normal or mildly elevated PTH. Now let's see why you were wrong. Choice A cannot be the answer because steroid hormones, thyroid hormone, and vitamin D act by binding to intracellular receptors with DNA-binding domains that interact with the regulatory DNA sequences of target genes. Choice C cannot be the answer because transmembrane ligand-gated ion channels the ionotropic receptors allow a regulated flux of calcium, sodium, potassium, and chloride ions across the cell membrane. Neurotransmitters that work via ion channel-linked receptors include acetylcholine serotonin, N-methyl-D-aspartate, and gamma-aminobutyric acid. Choice D cannot be the answer because insulin and insulin-like growth factor work by stimulating transmembrane receptors with intrinsic tyrosine kinase activity in the intracellular domain, initiating a downstream phosphorylation cascade. Choice E cannot be the answer because Janus kinase, or JAK, is a cytoplasmic protein activated by ligand binding to transmembrane receptors. JAKs activate cytoplasmic transcription factors called signal transducers and activators of transcription, or STAT, which enter the nucleus to promote gene transcription. Examples of hormones using a JAK-STAT messenger system include erythropoietin, growth hormone, and prolactin. If you already knew the answer, or at least now know the correct one, click the like button.